Good morning to everyone. Myself, Dr. Arul Priya, Assistant Professor, Department of Zoology, Belalar College for Women, Dindal, Erode. Now, I am going to explain about what is cancer, what causes cancer, how is it treated. Everybody known about cancer is the second largest number of deaths in most countries. One out of every two men and one out of every three women will be diagnosed with cancer. But despite those huge number, most individuals don't know what that they really means. A cancer is a tumor. It is an abnormal growth or enlargement of tissues. It has no connection with the normal tissues. It is independent, autonomous, uncontrolled growth of your tissues containing a mass of aberrant of or abnormal cells. A tumor serves no useful purpose. It is a harmful as it grows at the expense of the host like a parasite. The tumor is of two types. One is benign tumor and another one is malignant tumor. The benign tumor remains fixed in the place of origin. It will not spread from one place to another. It can be cured by surgically removing the tissues. The malignant tumor spreads one place to another through circulation and invasion. The spreading of tumor from one place to another is called as metastasis. The characteristics of cancer. A tumor arises from an existing tissue or cells of the body. The growth of tumor is autonomous, that is, it follows its own laws of growth. It's not regulated by those governing the tissues from which it grows. The tumor cells the tumor cells are undifferentiated and anaplastic nature. It means anaplasia refers to the diversion of differentiated cells into undifferentiated cells or embryonic cells. They have greater potential for growth and multiplication. They carry out none of the functions of normal adult cells. They have large or irregular nuclei. They lost their contact inhibition. Next, I am going to explain about properties of cancer cells disobeying the laws of cell division. The cancer cells do not follow the laws of proliferation. They divide automatically on their own without the need of the body. Next property is immortal. Cancer cells avoid apoptosis, that means programmed cell death. They become immortal. Third one is de-differentiation. Cancer cells return to undifferentiated condition and they can attain the property of embryonic cells. Uncontrolled proliferation, cancer cells generally proliferate indefinitely. Cancer cells are invasive and can spread to other tissues and organs. Tumor cells originate from normal cells through mutation caused by mutagens like chemicals, like physical, chemical, and biological factors. Cancer cells are generally unstable, lost their ability to repair their damaged DNA. Normal cells stop movement and division when they make contact with each other. This phenomenon is called contact inhibition. Cancer cells have no contact inhibition, so when a cell loses contact inhibition, it becomes cancerous. The nucleus of cancer cells is larger in size and irregular in shape. The nucleolus is also larger in size and it exhibits hypertrophy. Chromosomal abnormality. Most of the cancer cells are characterized by chromosomal abnormality. This is due to abnormal mitosis. In myeloid leukemia patients, the long arm of chromosome number 22 is lost. Hence, the chromosome is short. This short chromosome is called Philadelphia chromosome. The misbehavior of centriole is another characteristic feature of cancer cells. In any non-dividing somatic cells, the two centrioles are close to each other and are regularly disposed so that their long axis forms a right angle. In cancer cells, the two centrioles are separated by long random distance. They are randomly oriented towards each other. They also do not have any spindle fibers. The most visible property of cancer cell is their invasiveness of other tissues. It is primarily a property of plasma membrane. It becomes leaky. The tumor cells contain tumor associated antigens on their cell membrane. Gap junctions disappear in cancer cells. In the plasma membrane of cancer cells, fibronectin, a glycoprotein, is reduced or absent. Fibronectin is a component of cell adhesion, hence, the cancer cells lost contact inhibition. The cancer cells release an excessive amount of growth promoting factors. They escape by leakage through the cell membrane. After it has leaked out, it acts on the surfaces of the neighboring cells. The result is a dramatic spurt in growth and cell multiplication in normal cells, which also become abnormal in shape. Ribosomes and rough endoplasmic reticulum are abundant in cancer cells. Golgi complex and lysosomes decreases. Glycolysis occurs as faster. Cancer cells use more blood sugar. Next, I move to the tumor progression. In man, cancers are most likely to develop in the skin, lung, prostate glands, stomach, intestine, mouth, etc. In women, the commonest sites are breast, uterus, intestine, stomach and skin. The development of tumor is progressive process involving several phases, of which three are evident: initiation, promotion and progression. Initiation, it is the appearance of cancer where a normal cell begins to form itself into a cancer cell. The initiation is brought about by carcinogens, viruses, hereditary of gene mutation. It depends primarily on a specific pattern of damage to those genes which are involved in cellular homeostasis. In the beginning, only one normal cell is transformed into a cancer cell. This transformation is due to gene mutations and chromosomal aberrations caused by mutagens such as chemicals, X-rays, viruses, etc. Next stage is the promotion stage. During the stage, the change from a dormancy to progressive growth occurs. The cell is stimulated to divide. This abnormal cell disobeys the laws of cell division and begins to divide like embryonic cells. It produces a mass of cells which form a clone. All the cells in the clone are similar and they inherited the mutation of a original cell. The cells go on dividing to produce tumor. Normal cells divide to a limited period and then stop dividing, undergo differentiation. But the cancer cells do not stop dividing and they do not undergo differentiation. The third final stage is the progression stage. In this stage, the cancer cells lost contact inhibition, leak out and enter the blood vessels. They are carried by blood and are deposited in a new place. In the new location, they proliferate to produce cancer. The new cancerous growth is called metastasis, and the transmission of cancer cells from one place to a new place is called metastasis. During tumor progression, three important events occur. They are loss of contact inhibition, metastasis, and angiogenesis. As dividing cell stops when it comes contact with other cells. In contact inhibition, a cell to cell contact inhibits division. In cell culture, mammalian cells adhere to the bottom of the T4 flask and it will spread out until a confluent monolayer is formed. When a cell contacts its neighbors on all its sides, it stops dividing, so they form single layer. Cancer cells loses their contact inhibition and continue to grow so that they pile upon top of the other. The spread of tumor cells from one place to another place is called as metastasis. The cancer cells secrete a protease enzyme called plasminogen activator. It activates serum protein plasminogen, converting into another proteases called plasmin. The plasmin digests the basal lamina of epithelial and endothelial cells. When basal lamina is eroded, the cancer cell is free to move into a bloodstream or lymphatic vessels. The tumor cells that entered the blood may be trapped in the lung, kidney, and other organs and start secondary growth. The tumor cells that entered the lymph become trapped in the lymph nodes and cause lymph node cancer. The formation of new blood vessel is called angiogenesis. The primary and secondary tumors require blood vessels for their growth. The new blood vessels supply the tumor with nutrients and oxygen. Next, the origin of cancer is various theories have been postulated regarding the origin of tumors. They are Conin's theory of embryonic cell rest, hypothesis of Waldeyer and Thier's, hypothesis of anaplasia, theory of cell variation, immunological therapy, and defective Krebs cycle. According to the Conin's theory, during the early development of the embryo, islets of cells may be misplaced and may become intermingled with other tissues. These cells acquire the power of proliferation and growth in later life. Next, the hypothesis of Walder and Thier's. These authors says that under normal condition, there is a static equilibrium between epithelial tissues and connective tissues with respect to their proliferative capacity, one restraining or checking the other. With the advancement of age, this checking power of the connective tissue is lost. As a result, the epithelium gets the upper hand, proliferates rapidly and give rise to carcinoma. Hypothesis of anaplasia. According to this theory, Huntsman differentiated the cells occasionally come back to the embryonic type of anaplasia, resulting in the reproduction of more primitive type of cells. The greater is the degree of anaplasia, the greater is the malignancy. According to the Hardose theory, he states that carcinogenic agents inhibit normal cell function and that tumor growth is the result of process of adaptation to an unfavorable environment. The injured cells give rise to a new race of cells with a permanently increased rate of vision. The carcinogen acts as an enzyme poison, resulting in the appearance of a new enzyme which gives the cell a capacity for unlimited growth. According to the Green's theory, the carcinogens unites with special cellular component to form antigenic complexes leading to immunological reactions, destroying those cells which contain the antigen. This also favors the emergence and proliferation of cells which lack it. Warburg's theory suggested that cancer is caused owing to an injury to the cellular respiratory apparatus. The chemicals producing cancers are supposed to affect the aerobic respiration, that means Krebs cycle of cells. Owing to injured aerobic respiration, the rate of anaerobic respiration increases. The anaerobic respiration releases only a small amount of energy compared to aerobic respiration. This small amount of energy is incapable maintaining the structural integrity and the organization of the cells. This leads to controlled cancerous growth. In short, a cell becomes cancerous when its aerobic respiration becomes anaerobic. As the cancers grow in an uncontrolled fashion, they become a menace to life. They interfere with body fluid functions. The pressures that they create produce severe pain when the nerves are affected. The malnutrition goes hand in hand with cancerous growth. The cancerous cell tissue seems to draw the nutrients taken in the body. Normal tissues are deprived of their fair share of these nutrients. A cancer of the pituitary gland or hypophysis may cause abnormal growth and the victim may become a dwarf or a giant. When the pancreas is affected, there are often digestive disturbances and diabetic symptoms. A cancer in the brain and the spinal cord causes paralysis. Some cancers can corrode blood vessels and cause sudden death by hemorrhage. These are all the symptoms for cancer. I given just a few symptoms of the cancer like lump, formation of lump, weight loss, skin color changes, bowel or bladder habits, cough, difficult swallowing, indigestion or discomfort after eating, muscle or joint pain, fevers or night sweats, bleeding, constipation and abnormal menstrual cycle. Next, I move to the causes of cancer. The cause in the present state of our knowledge, it is still not clear just what causes a cancer. However, there are certain contributing factors. There are many factors are involving, like external factors, physical factors, and biological factors. I given here some physical factors are involving to cause the cancers, like X-rays, gamma rays, UV rays, and electromagnetic fields. Some chronic irritation also causes the cancers. There are various examples. Irritations caused to the tongue by broken or malformed teeth has often led to the cancer of the tongue. Cancers of the lip were quite common when clay pipes were in use. These are all the some chemical factors are involved in to create to cause the cancers, such as aniline dye, arsenic, aflatoxin, arsenic, asbestos, benzene, butter yellow, cadmium, carbon dioxide, coal tar, erionite, hexavalent, lead, etc. And this is the biological factors. Helicobacter pylori is the bacteria. It also involving in the cancer causing, and some viruses also involving in that, that is HPV, EBV. Some internal factors also causes the cancer, such as breast and ovarian cancers like that. Some imbalance of hormones also causes the cancer. Cancer is generally classified into four categories. One is based on the site of origin, tissue types, grade, and stages. Based on the origin, there are skin cancer. There are 200 types of cancers are nowadays discovered. One is the skin cancer, lung cancer, breast cancer, colon cancer, bladder cancer, intestinal cancer, anal cancer. Based on the tissue types, there are classified into 8 categories on the basis of position, on the basis of tissues. First of all, cancers are classified into 2 types. On the basis of position, they are malignant tumor and non-malignant tumor. Malignant tumor means it grows rapidly and spreads from the place in which it is started to the other parts of the body nearby or far away. The non-malignant type of tumor means benign tumor. It is confined to the area in which it originated. Its growth is always slow. Secondly, physicians classify cancers on the basis of the tissues in which they originate. A few are given below: carcinoma, sarcoma, osteoma, fibroma, glioma, melanoma, lymphoma, and teratoma. Carcinoma means the tumor arising from epithelial cells. It occurs on the skin and in the lining membranes of internal organs. Sarcoma or malignant tumors arising from any connective tissues. Osteoma are tumors arising from the bones. It is a fibroma means it is a tumor arising from fibrous tissues. The glioma means these cancers develop in the network of supporting connective tissues in the brain and the central nervous system. Finally, the melanoma is a rapidly growing pigmented tumors. It is originated in certain types of pigmented molds found on the skin. If these molds are irritated, they rapidly become malignant, and they resulting cancers metastasis rapidly. Lymphoma means the cancer's growth are developing on the lymph nodes and the other tissues of the lymphatic system are called lymphomas. Teratomas arises from cell rest derived in the morula stage itself. Later they acquire the ability for growth. It is suggested that teratoma is a suppressed fetus resulting from another undifferentiated germ cells or a fertilized polar body, or it develops by parthenogenesis. In other words, teratoma is considered an inclusion of a parasitic fetus in an individual. Next, classification by grade. The well differentiated cells are comes under the grade 1 category with slight abnormality. In grade 2 category, moderately differentiated cells and slightly more abnormal growth of cells are comes under the category of grade 2. And the third category is the poorly differentiated cells and very abnormal cells are comes under the grade 3 category. Final, the grade 4 is the immature and undifferentiated cells are called grade 4 category. Based on the stages of cancer, we classified into four categories. One is the localized to one part of the body, usually it is curable, and the stage 2 and stage 3, stage 4 is the metastasized. It does not cure very easily. Next, here is the list of symptoms. Here is the given list of diagnosis method. Any sore that fails to heal or any sore that heals but returns. Any continuous or replaced discharge or bleeding from any opening in the body. Any lump or mass, whether a sore or not, that appears in a tissue, particularly a lump developing in the breast, indigestion or any abnormal feeling in the stomach, which persists or disappears but returns rapidly. Any such things as a alternating constipation or diarrhea, unexplainable loss of weight, persistent cough or sore throat. If a person has any one of the symptoms only once, there is no reason to be alarmed. However, if they persist or if they keep coming back, it is wise to consult a competent physician. Biopsy means it is a technique by which a suspected cancer tissues can be tested. It is a liable technique. It consists of microscopic examination of a small portion of suspected tissues. X-ray is the another diagnostic method. It also used to diagnose the cancer that affect the digestive tract, kidney and chest. Next, I move to the treatment. There was a time when the diagnosis of cancer was equivalent to a sentence of death. Today, cancers can be cured. Almost all cancers start at some definite location in the body, but a few start in more than one place. It is vitally important to root out any cancer at its starting point before it invades nearby tissues or before it sends cells to the other parts of the body. A cancer can be cured by completely removing the cancerous growth, that is means by surgery. Cancers can be treated successfully by treating them with X-rays or radioactive substances. Beams of radiation are focused on the tumor. The radiations kill the cancer cells. In some cases, minute particles of radioactive substances are inserted directly into the cancerous tumors to kill the cancer cells. In laser treatment, a reddish-black drug called hematoporphyria derivative is injected into the body. It is retained only by the cancer cells. After 1 or 3 days, tumors are loaded with the drug, but most of the normal tissues are free from it. The drug glows in the blue laser light, allowing the doctors to precisely locate the tumor. Dr. Alan Weil said that the young tumors which cannot be detected by X-rays can be traced with the help of the blue laser light. Once the cancer is located, it is attacked by focusing a red laser beam on it in a single course of treatment. The red laser beam activates the HPD to kill malignant cells. In magic bullet treatment, the tumor cells have tumor antigens on their surfaces. Antibodies are prepared against these antigens under in vitro conditions. These antibodies are linked to a toxin. For example, resin is a toxin for a lymphoma tumor cell. The resin is linked to the antibody prepared against B lymphoma tumor cells. The antibody linked to resin functions as the magic bullet. It is triggered into the blood of the tumor patient. The magic bullet moves towards the tumor cells and combines with the antigen of the tumor cell. From there, the toxin gradually diffuses into the tumor cell and the tumor cell is killed by the toxin. In the stem cell transplantation, leukemia, myeloma, and lymphoma can be treated by stem cell transplantation method. Finally, the chemotherapy. In this chemotherapy, treatment of cancer using drugs is called chemotherapy. There are cancer drugs inhibit metastasis. Mustard gas is used as a cancer drug. It adds alkyl group to the guanine of DNA of cancer cells. This prevents replication of DNA of cancer cell and stops division. Vinca alkaloid is the compound derived from the Vinca rosea plant. It is a herbal plant. This drug destroys spindle fibers and stop mitosis. The drug irinotecan and topotecan obtained from the Chinese ornamental tree Camptotheca acuminata inhibit DNA gyrase enzyme activity. Hence, the DNA double helix cannot unwound and DNA replication cannot occur in that. So, it is a combined treatment therapy only now available. There is no single curative methods in this world. So finally, thanks to everyone to listen this video.